Hi, greetings for the day. I'm Dr. Nimish Shah. I'm a consultant in pulmonary and sleep medicine at the Sir H. N. Reliance Foundation Hospital. And today I'm going to talk to you about investigations in asthma. So, the diagnosis of asthma is very essential when you first meet the patient, and a clinical history always forms the basis of getting a diagnosis of asthma. We have relevant investigations which confirm the diagnosis of asthma, because confirmation of the diagnosis is very important, as there are multiple conditions which do actually present like asthma. So a basic chest x-ray to make sure that there is no other cause which may be presenting as asthma. A spirometry and a lung function test is very important, because this actually is a diagnostic test for asthma. So we do a blowing test where the patient blows in and out of a machine with the help of our technician and a doctor in attendance, and that tells us whether the patient has asthma or no. We also add in a medication where we look for changes in the lung function test, and sometimes when you have a clear history of asthma and the lung function test is normal, we can do what we call the bronchial challenge test or a bronchial provocation test, where we actually induce wheezing, which is one of the symptoms of asthma, and that can give us a better diagnosis of asthma if the spirometry and the baseline lung function test is normal. There are newer adjuncts in this type of a test called the FeNO or the nitric oxide test, and it tells us and gives us a brief idea about the control of asthma the patient has, and it also helps us titrate the medications appropriately. Coming to blood tests, so a complete blood count to look at the eosinophil value, and if the patient has allergic asthma and allergic symptoms, then we do what we call as the IgE level, and along with that we can also add in some extra tests such as an specific IgE level. So we can look up specific triggers for the asthma, such as dust, pollen, mold, fungus, pet dander, so animal dander, essentially cat, dog, and there are certain food items as well which we can test by doing specific IgEs to look at a baseline whether they may be symptomatic with that or not. Similar to a specific IgE is which we can do in an outpatient basis is called a skin prick test, where we just inject a little bit of a reagent into the patient's forearm, and that gives us a similar result but a more quick one. Within 15 to 20 minutes it gives us an answer whether the patient has certain allergies or no. Thank you very much.